Hello everyone and welcome to our next monthly Alphazita webinar. It's lovely to have you join us. I can see lots of people joining live at the moment, which is wonderful to see those numbers going up. We had, I think, just over 200 people register for this webinar, which I think is our highest attended one yet. And I'm not surprised because what we're going to be sharing today is really interesting. Claire just speaks about this subject in such an amazing and connecting way, and I can't wait for you to experience this and learn more about fertility massage. So that is the topic of today's talk. My name is Sarah Holland. I'm a member of the Alphazita team, and I'm going to be introducing you to Clare Spink and Dr. Elias Tsakos, talking on how fertility massage supports your fertility journey. We here at the Alphazita team are a multidisciplinary team combining both medical doctors and natural therapists and practitioners, bringing you the best that we can offer in fertility support and care. We have lots of different ways that we can support you and lots of news coming up about our team and all the different things that we're doing this year. And we have an announcement actually that we're making during this webinar. So we're not going to do that now. We want to get on with the talk about fertility massage, and we'll get into that in a second. But do stay tuned right till the end, where we're going to share a really exciting announcement with you where you can get some free support from the team immediately. So it's going to be really exciting. Also, at the end of this session, we are taking your questions. So if anything that you hear from Claire, from Dr. Tsakos, and some other surprise speakers that we have here as well, anything that you would like to ask any of us, please feel free to write that into the chat or the Q&A box, and we will get through as many of those as we have time for towards the end of this session, which is around 40 minutes. So we're hoping to cover everything that we need to in that time. So I'd love to get started in this topic, but first of all, just to introduce you to Dr. Tsakos and to Claire as two of the other members of the Alphazita team that are here this evening talking about this amazing topic. Dr. Tsakos, can we begin with you? Would you like to give a brief introduction about who you are and why you're here?
Sure. Thank you very much for the introduction, and thank you, Claire, for being here, and all the attendees, and of course the special VIP guests we have tonight. For me, it's a great honor to be part of this team because as a doctor, I've always felt that there was something missing in our service to our patients. I've always thought that providing just technical and medical and scientific evidence and help was not enough. And our couples on the fertility journey, they needed much more than that. So it's been a huge privilege to be able to link with Sarah Holland, Claire Blake, Gordana Petrovic, and Rosie Letts in this Alphazita team, and to share our common passion for truly holistic fertility care for patients. So I hope this is going to be very exciting for our patients, because I personally would like to share the excitement that my patients expressed when they got in touch with fertility massage and what fertility massage can offer to them in their fertility journey, both physically but also emotionally and spiritually. So I'm looking forward to a wonderful webinar.
It's still so amazing to hear a medical doctor, an IVF doctor, talking about using fertility massage in clinic. And I know you're going to talk about that more later, but it's so special to hear that. So, and I know it will be very unusual for a lot of our listeners hearing how we can bring together the medical and the natural worlds in this way. So thank you very much, Dr. Tsakos. Claire, would you give a brief intro as to who you are and why we're here hearing about your wonderful topic?
I wasn't Claire Blake, I'm now Clare Spink. Confusing everyone with the name change. I am still absolutely humbled and honoured the fact that Dr. Tsakos brought me into this team. I remember the first time I met you, and you shared how your passion and your vision was that all your fertility clients felt loved and nurtured and held through their journey. And I knew that moment that I had to be part of this team. So I'm still absolutely amazed that, you know, like you said, Sarah, a doctor from the medical side has this bigger vision. So thank you. So I'm Claire, and I created fertility massage, I think about 12, 13 years ago. I've now gone on to teach nearly 500 therapists worldwide. I have 8 wonderful associate instructors who now also teach for me. One of those will be joining us tonight from the Netherlands. And we all have the same vision. We just want to help couples, but to help women particularly in healing their womb, and helping them to connect in so that they can call in their babies and work with the medical world as well. So yeah, I'm looking forward to sharing lots more about fertility massage.
And we'll see exactly how much we can share in this time that we have, because I know we've done it before, Claire. We've been online before talking for an hour and a half or more about this topic. So we're going to see how much we can share here. And of course, like we mentioned before, there's going to be a way that you can connect with Claire and the rest of the team on an ongoing basis. So we'll talk about that shortly, but let's cover as much as we can now. So first of all, Claire, could you explain briefly what fertility massage is and how it's different to a regular massage and how it can benefit fertility?
Yeah, so with fertility massage, we focus on two key areas. We work on the lower back and the sacrum, because the nerves that run down either side of the spine and through the sacrum feed directly into the reproductive and the digestive system. And so we know that obviously the reproductive system is vital for fertility, but so is the digestive system. We hold 80% of our immune system in there. We make 80% of our serotonin, so our happiness is created in there. And we need to be happy to make babies. We also work on the fronts. We work from the pubic bone up to the rib cage, focusing on improving the circulation. We only get roughly about 5% of our blood flow into our womb, our fallopian tubes, our ovaries. And if we've got any restrictions, so if we've got a tight diaphragm because we're not breathing properly and into our abdomen, if we've got maybe constipation or any other congestion, scar tissue in our abdominal area, we're not going to get that blood flowing into our womb space. We need we need blood, because it brings in fresh nutrients and it takes away the waste products. So our key focus from a physical point of view is getting the womb as healthy as possible by getting as much circulation into that area, and also trying to alleviate any tension that is holding the womb, maybe in a misaligned position, because if she is misaligned, she may not have such fresh blood inside her, so you may get brown blood at the beginning of your period or the end of your period, and that is usually where she's flexed or hunched over, and so the blood can't flow out easily, and so you're getting that congested blood in your womb. So we want to get as much of the blood flowing out of the womb so that you have a nice bright red blood flow at the beginning of your cycle and at the end of your cycle, so that you've got fresh lining, which is obviously going to be the best place for bringing in an embryo, whether that is through the natural conception or through IVF. So that's the key physical areas. Then we have so much when we come to the emotional side, and that's where fertility massage is really different from just a normal massage, because a normal massage, yeah, it will get the circulation going if they're working over that lower abdominal area, but we also really focus on dropping in and trying to understand what story the woman is presenting with. I say woman because in my practice, I very rarely see a man. I'd love to have both partners, because a man makes up 50% of a baby, but we just never get men in. So we work on the women and hope that the women can feed back into the men. But it's the emotional side of things. We have certain muscles that hold certain emotions. So the liver holds anger. There's a lot of anger that comes with fertility, whether that is, frustration or upset. Could be jealousy and anger around other people around them. But the key muscle that I really want to talk about is the psoas muscle, which really isn't an easy muscle for me to say with my lisp. So it's a muscle that runs either side of the womb, and it connects in. So it connects from the lower thoracic of the spine and connects in either side into the top of the legs. And it runs either side of the womb area. The psoas is the muscle of fear. And that fear is the first muscle that develops when we're inside the mother's womb. And so if our mother has any fear around giving birth, or how she conceived you, or how is she going to cope when she's got you on the other side, then the psoas muscle is going to clench up. And it means that if we are exposed to a lot of fear inside our mother's womb, then when we are born, we come out on a sliding scale. So it's not going to take that much to send us into a bigger fear. And because the psoas is like a caterpillar, it will tense up. And so it restricts the blood flow, it restricts the energy within our womb space. And so that's one of the big muscle areas that we focus on within the massage. And we try to understand what is the fear that they're holding. It may even be fear that themselves, they don't want to be a mother like they had. They don't want to maybe give up their career or lose their identity. So our work as a fertility massage therapist is also to understand what is the story that's coming in. And then one more that I will just talk, because there is loads and I won't go on forever. But one of the key ones as well is our ancestral healing. We start life as a little cell inside our mother's womb and inside our grandmother, so our maternal grandmother. So if we think about our maternal grandmothers and the emotions that they felt and the imprints, the patterns that they had, it can affect us. And there can be a lot of fear around giving birth, because maybe your grandmother have lost babies. It may be even just fear around their own sense of identity. A lot of women of the, who would have been in their 80s or older now, would have been around the wartime, and the women were, they had to stay at home. So there was, lots of different patterns that go with that. And then we carry those patterns within us. So we do trying to work on the ancestral healing and figuring out what are the patterns that we're holding, what are we carrying with us going forward. So fertility massage, it supports any IVF in the fact that we're working on the emotions and we're working physically. And I know that Dr. Tsakos later on will probably share some of his experiences of what has been beneficial from having a therapist in his clinic. But it is not just it's not just a massage. It is a whole therapy, and I can't express that enough.
I would agree. And I didn't appreciate this till I had a fertility massage myself with you, Claire, how it was so much more than a massage, and it's truly holistic in the very sense of the word. And yes, we could go into all those different aspects. The area that really interests me, as I'm sure you know, with the work that I do, is the emotional side. And you mentioned briefly there about the emotional aspects and different emotions that can come up. Could you tell us a little bit more about the kind of emotions that you deal with, the different aspects in a clinic? How does that look?
Yeah, we see also we see a lot of conditions that come through, like polycystic ovarian syndrome. And yes, there's the medical reasons that are going on behind something like that, but it can also be that maybe when they were in the mother's womb, the mother wanted them to be a boy, or the father wanted them to be a boy. Or there can be that when they were small and they were growing up, there was a lot of talk around how maybe boys are, certain cultures particularly, that boys are of more value or better. And so polycystic ovarian syndrome has that kind of emotional pattern to it. And I know I've seen quite a lot of women. I had one client once who, she was the sixth daughter, and progressively all the daughters had got worse and worse with their polycystic ovarian syndrome. And it's because the father just kept on wanting to get a boy. They ended up giving up after the sixth daughter. But she could really recognise that pattern. And we worked on reclaiming her feminine, really reigniting that feminine within her. And she did. She went on to not only get her periods back to being regular, but she went on to conceive and have a baby. And so that was probably my biggest kind of result with polycystic ovarian syndrome. But I know another one we see huge amounts of is endometriosis. And I am going to pass over to my lovely assistant, Janine, who I know has a very lovely success story with endometriosis.
Hi, Claire. Yeah, I have. My name is Janine. I'm one of Claire's associate instructors in the Netherlands. And I'm also doing a lot of breast health work. And from that side, people come also to me. In this case, it was a woman with endometriosis, and already struggling with her first conception through IVF after a long journey. And for me, endometriosis is all about knowing your boundaries, knowing where you can. What's you and what's the other, and I've seen a lot of women with endometriosis that they have problems with setting their own boundaries and giving too much from themselves. And in this case, the woman was so happy to finally conceive for her first child, and she was in a very responsible job. busy job, quite stressful. And of course, her whole fertility journey was stressful, with a lot of miscarriages, a lot of grief, a lot of fear, a lot of anger. And when she finally wanted to have the second one, she couldn't conceive again. So her whole journey started again. And at some point she came with me and she wanted to do treatments with me. And so one of the first things I said to her, I shared my thoughts about endometriosis and her boundaries. And within seconds she started to cry. And the treatment didn't even started yet. But there was already a big release at that moment, because she realized that I was right. And during the treatment, she had big releases. We had several treatments. Unfortunately, you can't do it all in once most of the times. And she noticed within her treatment that the egg collection, she got the medication was doing its job better. So she got more eggs. She got more. The quality of the eggs was better. And at the end, she finally did conceive for her second child, and now she's mom of 2. And in meantime, I think she cleared so much stuff up. She recognized she was more burnout than she thought because of the first, and because of all. She kept going and going and going, and her endometriosis got worse and worse and worse, till the moment she realized, okay, I need to set my boundaries, and I need to rethink and refeel, where am I in life? What is mine? What is the other? What things are going to make me happy, instead of always giving the other one? So yeah.
Thank you, Janine. That's fascinating to hear the different backgrounds, the emotional background that you see with endometriosis and the ways we can go about resolving it. It's fascinating. Thank you for sharing. And thank you, Claire, for inviting you along. It's always great to meet other members of her team that I know are worldwide now. So it's wonderful to see all you out there doing the fertility massage therapy. Thank you so much for joining us.
Thank you.
Now, Claire, I know you have another special guest. You've been very busy organising all of this, and I know you have another guest of someone who had treatment with you, who then successfully went on to become pregnant. So we'd love to meet her as well.
Yes. So I had the absolute pleasure of meeting Joanne back in 2013 off the back of one of Sarah Holland's telesummits. And Joanne walked in and said to me, put the paperwork away. We don't want to talk about anything that's medical. I just want to drop into the emotions. And I was like, here's my woman. And it's been an absolute joy. I've worked with Jo now. She's going to share her story in a moment. But I worked with Jo a couple of times because babies. And then last week I had the pleasure of having Jo on my London course, because her life transformed so much that she's now an intuitive fertility coach, and also has now studied with me in fertility massage. So be careful if you come to see me, because it might be your life. So I'm going to introduce you, Jo. Would you love to share? I'd love you to share your story.
My gosh, it's such an honour to be with you guys. Can't believe I'm here after, in 2013, I was one of your listeners, Sarah. And when I heard Claire talking about massage, I just instantly knew I needed to book an appointment with her. I just thought, she's my woman. And I got in touch, and as soon as I walked in, I told her, I'd been diagnosed with 5% chance of conceiving naturally. Egg donation was the only way to go. And yet in my heart, I just knew that there was a little boy out there for me, and something switched after hearing Sarah's teleseminar. I just thought, I don't want to hook on to those negative thoughts any longer. I need to get back into my body. So when I went into Claire's room, I said, I can't talk about everything that I know. I don't want to talk about the doctors. Just get me on that bed, and I just need to go inward. Let's me reconnect with my body, which I actually started to hate because it let me down. My womb, I just did not like. So I had 2 sessions with you, Claire. I think it was 2 sessions. But when we were together, there was just such magical moments. And you mentioned afterwards, you said, I can see a snake. And it was really interesting. I went home that evening, and that weekend we went to the local reservoir, and my husband turned over this rock, and we saw this snake with a baby snake, and I was just like, oh my gosh, my baby's definitely coming, it's gonna come soon. It was just a sign, but it was just so lovely to get. The massage is just so healing, because you just go inward and you reclaim your body, you reclaim your femininity, you reclaim who you are. And since meeting you, and my life has changed. I now work with other mummies to be, and I support them in my way. And and now I've trained with you, Claire. It's just crazy. So thank you. Yes, whoever's thinking about having a massage, do it and go inward.
Thank you so much, Jo. Thank you. So
Amazing.
I add a tiny little bit to that. So Jo had premature ovarian failure, and from an energetic point of view, we believe that when your ovaries shut down, or when your ovaries are not really that happy, that energetically it's to do with grief. And that was one of the first questions I asked you. Okay, where's this grief coming from? And that grief can be anything. It could be the fact that you're not conceiving every month, but for you, Jo, it was a personal thing with your father. Energetically, he kind of came in and gave your ovaries a little boost.
Yeah. My father had just had a stroke, and he was not a well man anyway. But yeah, it was such an insight. I realised I was carrying that around. So.
And then when Jo came back the second time to see your daughter, again, your ovaries had completely kind of gone, we've shut down, and that time your father had passed.
Yeah.
So again, it was the grief that she was holding in her ovaries. So it's really important to know that our organs and our body, it holds emotions and it holds trauma. And I know certainly working with Sarah in EFT and working with body work, it's a beautiful blend in combination. So thank you, Jo.
That's okay. Thank you.
Thank you, Jo, for sharing your story. That's really, really special, and hearing, what a huge impact it's had on your life on an ongoing basis. You're truly in Claire's world now. There's no escaping. Now, we've mentioned that, Claire, you have trained, did you say almost 500 fertility massage therapists around the world now? And we know that there is also, this has reached Greece as well. And Dr. Tsakos, you have a trained fertility massage therapist who works with you and your patients at Embryo Clinic in Greece. So I wondered if you could tell us a little bit about what that experience has been like. I think it's been for the last 18 months. It would be lovely to hear a bit of that experience from a clinical perspective.
Sure, absolutely. I mean, before I go into that, if you allow me, it was actually fascinating listening to the stories. But if I may, there's one common point into those stories, and this is the fact that those women didn't give up. And as a medical doctor, this is what I need, because when we put the science together and we quote 5%, 1%, 0%, whatever, these patients have only one risk: to give up. And nature is always wiser than us. And with fertility massage, with truly holistic approach, with truly physical, emotional, and spiritual contact with members of a team, which is not exactly the scientific and the sort of core medical team, these people can carry on, and they can carry on hoping, and they can carry on presenting themselves into this opportunity, because eventually nature is much wiser than us. Eventually, we don't know much about everything. We don't know, what's the cause of endometriosis. We haven't discovered that yet. We don't know exactly what's happening with polycystic ovaries. So there's a lot of idiopathic terminology, and idiopathic is all fancy Greek for we don't know, and so forth. So we do need you. We need people like Sarah Holland, like Clare Blake, like Gordana, like the truly holistic team, because we need an extra support team for our patients. And when we feel that there isn't very much more we can offer them from our point of view. And if you allow me also, medicine has embraced the holistic approach overall. I mean, you know, our oncology colleagues, they work alongside psychologists, palliative care physicians, physical therapists, and so forth. So I think this is the time for the fertility world to embrace a truly holistic team, because it's not just us that we need you, medical doctors, it's primarily the patients who need you. So it's very important to have this connection and have this context which is truly, truly humane and truly holistic. So with regards to our experience, I mean, you know, we found out about Clare Blake, of course, because she's the one. She's the one who invented fertility massage. She's the one who made it possible and made it happen. So we invested by sending one of our colleagues, one of our associates, to train with Clare. And of course, she came back to bring some of the experience, and of course, not all of it. And it's been an absolute eye opener, because the support, the contact, the emotions, even the physical consequences of fertility massage have been amazing. We treated women who hadn't been able to have a scan without a light anesthetic or some sort of sedation. We had women who were absolutely impossible to have an embryo transfer without some sort of sedation. And following fertility massage, these women were much better. The experience was much better. You know, our job was much easier. Whether it was scanning them or doing the embryo transfer and so forth. It's very difficult to quantify the results. Having said that, when fertility massage is working in the context of a scientific evidence-based medicine and fertility overall approach, then of course there are some positive outcomes. Very difficult to measure. In my opinion, the most important is the experience. So we did an audit to our patients, and we found that they all scored an amazing experience. We had people who were nearly ready to walk out of the door because they came for post-failure counseling, and we threw in some free fertility massage just to relieve them and just to be able to approach them even more. And of course, these people came back for more treatment, and these people quoted a better experience afterwards. So in my opinion, the overall problem with fertility treatment is one. And this is the problem of giving up. This is the largest complication. We spend a lot of days, a lot of months in conferences talking about the 1% chance of ovarian hyperstimulation syndrome or bleeding or whatever, miscarriage, when the risk of miscarriage is 20%, 30% or whatever. But the largest risk of IVF treatment is failure. And with fertility massage and with the truly holistic approach, we then are able to prepare for failure to start with, and also to manage failure in a truly humane way. So it's made an outstanding difference in our practice. It gave us more bridges. It gave us more points of contact with our patients. The experience that the patients quoted, the couples, the single mothers, it was absolutely amazing. They were given the opportunity to try more. They were given alternatives and hope when they thought that everything was lost. Because as you're aware, in Greece, we're dealing with a low budget population. We're trying to do everything as cost effective as possible. The whole family is contributing into the couple's treatment, and the couple can only have 1 or 2 treatments maximum, and so forth. So the pressure to give to these people the very best is absolutely huge. So fertility massage has been an amazing, amazing add-on to our overall approach. And we have this amazing feedback, not only in terms of success, because cumulative success, of course, is increased by people who come back for more treatment if they've been unsuccessful first or second time, but definitely in terms of experience. And one last point I would like to make is that by offering fertility massage and by offering a truly holistic fertility approach, there's always increase in natural fertility. And I don't want, of course, to mention names, but one of our very special patients, only Gordana knows about this at the moment, has managed to fall pregnant naturally at 45 plus after so many failed IVFs, because she gave up on IVF, but she didn't give up on natural conception. And this is the true message of our job, I think. Thank you.
Thank you, Dr. Tsakos. And gosh, I think you've really epitomized what makes the Alphazita approach so unique, so special, and so needed in the world of fertility right now. And it is about, isn't it, empowering the patient, strengthening them, giving them that ability to continue and to be resourceful and, you know, continue down whichever path they need to. So, and then you see the success. So it's wonderful that fertility massage has been a big part of that. So thank you for sharing, and thank you, Claire, as well. It's been amazing to listen, and to Joanne and to Janine, to every aspect of this whole picture of fertility massage. Now, I know we've had some questions come in, and we do still have a little bit of time to answer some questions, so it's good. We're keeping on track, everybody. Well done. Despite us being so numerous now in our panel of speakers, we've done it. The first question came in via Facebook, where we're live streaming as well. Sam asked on Facebook, she said, I've had my egg collection 3 weeks ago and having a frozen transfer. Will I benefit from a massage before my egg transfer next month? Claire, is that something that you could answer for Sam? Is that a time when you might use massage?
Yes, because even though we can't alter anything to do with the eggs that are all being collected, we can still create as much circulation into your womb space, but also emotionally connecting you into your womb and bringing that those stress levels down, and helping you to alleviate any fear or any stress that is around that. So it is actually really positive when people do have the massage prior to egg transfer. So yeah.
Great. And I know that Sam is relatively local to me, so potentially she might be able to come to see you for a massage, or you do have other local people around. I think but could you give your site so that people can find their nearest fertility massage therapist?
To fertilitymassage.co.uk. One of the top bars is therapist locator, and providing it's working okay and we don't have a technical glitch, you can put in your postcode and find your nearest therapist, and that will tell you whether the therapist is fully trained or whether they are a student. If they're a student, it just means they're doing their case studies. So it's always quite a good idea to also go to see those who are doing case studies.
Fantastic, thank you. Catherine has also sent in a question. She said, I have PCOS, diabetes, and I'm 40 years old. I've tried acupuncture and I truly believed it helped me conceive both times. It resulted in miscarriages. I'm looking into fertility massage. I've also signed up for fertility yoga online program with Living Layla. Am I doing too much? Should I do one at a time? So that's acupuncture, fertility massage, yoga. What's your answers there? What do you think?
It's really tricky. I think it's finding, I mean, obviously we do work as a team, and it can be really lovely if you find people that work together, and it's what fits into your schedule. So if anything becomes too stressful, then it's not going to have the benefits that we need. So it's okay if you're doing acupuncture with massage and also and the yoga. They're all going to touch in different aspects and get, you know, different places, but try not to do too much. It's maybe just finding the things that really work for you. So it's a good idea to obviously have a massage, see whether it actually works for you or not. But yeah, something like PCOS is a little bit trickier normally to just deal with one thing, and I would never say just have massage or just have acupuncture or just do yoga. It's finding everything that can work with it, and obviously things like nutrition are also fantastic for PCOS.
That's the thing, isn't it, Claire? It's not just kind of doing a checklist of I must do all these different therapies and all these different approaches. It's finding out, actually, do I need this? Is this beneficial for me? Do I feel connected to it and enjoy it? And being quite choosy about how you create your plan, which I know can be tricky for people to know what to do and, you know, when it becomes too much. But yeah, when they're guided by people like us and the rest of the Alphazita team, we all work collaboratively with other people who are fertility specialists, who also work with other practitioners, so we can easily help create, you know, a program and a plan that works for that person, can't we, as a team? So So yeah, I don't think there's any such thing as too much, because it depends on the individual.
Too much self-care.
No, exactly. We usually don't have enough. That's true, isn't it? Very true. So let's see the next question that came in. Another topic that I know you like to talk about as well, Claire. Isla Rose Wolf said, do you think that yoni steaming can positively affect fertility? And if so, in what way? It seems very hard to find insurance for this therapy in the UK. Do you think it will be recognised alternative therapy soon?
Having had a one-to-one conversation with the insurance company, no, we're not going to get insurance in this company, in this country. I know there are people there's a US company that are training people, but there isn't insurance. It's due to the sterile, and also there is not enough research. I'm a massive fan of yoni steaming. I know you would have. Isla Rose is one of the therapists that trained up in Scotland with my lovely Andrew and Bex, but it's a really lovely self-care. There's not enough research out there that I know about. I know there are people that are doing research into yoni steaming. But I think anything that has a positive effect on you, so if it's an energetic effect of clearing out from the root chakra, then that's going to be beneficial in the fact that you're changing your mindset. And I think that's one of the things that's really positive is, letting go of certain emotions. That's always going to help. But I can't see that anytime soon we're going to get insurance for it, unfortunately.
There you go. While we're talking about emotions, Indra has asked, what can cause the blockage in fallopian tubes from an emotional point of view?
Okay, so if we think about the ovary, is obviously it has the seed of, like, our seeds of our intuition, our seeds of our visions, of our ideas, and the womb is the holder of those and the nurturer, and it's what cultivates it and allows it to grow. So I think energetically the fallopian tubes, if they're blocked, it's not allowing your visions to come to fruition. It's not allowing your ideas to really follow through. It's kind of like maybe there's a little bit of a critic inside you, kind of, just not, you're not good enough to do that, or, you can't fulfill that vision. So maybe it's along that line of, not allowing the visions to come to fruition.
Okay, thank you. Interesting. And our last question that has come in at the moment, unless any more come in, is from Katia, can fertility massage help also with endometrial hyperplasia?
This is where I need a little bit of help with my medical knowledge here, guys.
Okay, if I can pick that question, endometrial hyperplasia is usually an anatomical feature, so it is something that has to do with cells that are accumulated, and more often than not, those cells are in the route to becoming abnormal, either mildly, and hence we have the simple hyperplasia, or a little bit more abnormal towards the moderate or even atypical hyperplasia. So we need to be a little bit careful here. And again, in my medical opinion, I think it's very important to quantify exactly what hyperplasia is by doing a little biopsy. This could be done as an outpatient with a PIPEL, which by itself will ensure that we have the right diagnosis. And also by itself, this PIPEL diagnostic biopsy may serve as endometrial scratching, which may increase the fertility. So this has to be quantified and, of course, clarified medically before we can move on to alternative or complementary assessments and management.
And that is the benefit of working with both medical team and natural fertility, is that we can draw on each other's knowledge and support at the right time and know when to refer on. So that's really good to see. Thank you. That's why we work as a team. Fantastic. Thank you. I don't see any other questions coming in right now. So what I'd just like to do is to pass back to Clare and Dr. Tsakos if there are any final words that you would like to pass on to our listeners, who we have lots listening in live now. I know many more will listen to the recording as well. Is there any final words about fertility massage you would like to share before we make our big announcement at the end?
You put me on the spot now. I don't know. I'm trying to do a short one. I think it's just finding fertility massage is there. It's there to nurture you, to nourish you, to empower you, to reconnect your body from an emotional point of view. And if you're open to the energetic side of things, the spiritual side of things, then the massage is going to be a lot more beneficial for you. And it is a beautiful accompaniment to working with the rest of everyone in the Alphazita. Let me speak slower. The Alphazita team, because we all do complement each other so well. So I think I think that's my little final.
Lovely. Thank you very much, Claire. Thank you. And Dr. Tsakos, do you have any final words about fertility massage and this approach?
Fertility massage in the context of a team of conventional complementary therapists is a very important add-on to our overall fertility approach. It gives an extra, a huge point of contact, physical, emotional, spiritual, with our patients. It gives solutions where medicine perhaps doesn't have very much more to offer, and also it increases both the experience of the patients, but also the cumulative success of either natural fertility or assisted fertility, by the fact that people don't give up, and they always have more hope, they have more perspective, they have more something else, alternative treatments to be offered. So by not giving up, the overall cumulative success rate of those patients is increased. So it is a very important part of a holistic fertility team.
Thank you. And that's what we truly believe in, isn't it, here at Alphazita, is supporting fertility patients in the best way that we possibly can. And that isn't usually from one source, not just usually from your clinic or from a natural therapy practitioner. It is about building a support team around you of both professionals, of your friends and family as well, but, having a really good support network. So I'd like to make the announcement now that we've been building up to. Are we ready for it, team? And I see Gordana's watching as well on Facebook. So hello, Gordana is our fertility acupuncturist in the Alphazita team. We have a big year ahead for Alphazita. There's lots of exciting news and projects coming up. But what we wanted to do, first of all, was to invite you into our world. As we've seen with Claire, Claire's built an amazing network of fertility massage therapists throughout the world who are all connected to each other. And we want to help you, those of you who are on a fertility journey, become more connected to us, the Alphazita team, and how we can best support you. Yes, we have these monthly free webinars, which we really enjoy delivering to you, and they are absolutely continuing. But we wanted to take that a step further and invite you into a way of having our support anytime that you need it, and also being connected to other people who are on a fertility journey as well, because we know it can be a lonely time. It can be hard to find other people who are not only dealing with fertility issues, but also are approaching it in the same way that you are, in a holistic way and looking at all the different aspects. And it can be really useful to find a group of people that you can support and be supported by and be in their company. So what we have done literally today, ready for this webinar and to invite you in, is we have created a very special community on Facebook. It's a free but private Facebook group. So none of your friends or family on your timeline will be able to see that you're in there or see that you're posting. It is only for members. But it's a free Facebook group run by the Alphazita team, where every single member of the team will be in there, along with other people who are on a fertility journey. So you can come in, you can share your struggles, you can ask your questions, you can ask for support, you can ask specific questions to Claire about fertility massage, to Gordana about acupuncture, and the rest of the team, about their specialisms. And ask whatever you need, and we'll be there to support you on your journey. So if you would like to come and join us, you'll be literally one of the very, very first members if you come in now. If you go to Facebook and search for Your A to Z Fertility Club, so that's Your A to Z Fertility Club. We'll send you out the link via email as well. But if you search for that now, then you'll get straight through to our group. And click to join, and we'd love to welcome you in there. And feel free to come in and introduce yourself. Tell us what brought you there, what it is you're dealing with on your fertility journey right now. And if you have any questions, anything that you'd like support with, then do come and ask that as well. We look forward to meeting you there. So thank you very much, team. It's been amazing to speak with you again. This is one of the highlights of my month, to get together with us in the same virtual room with a lot of other people all over the world and chat all about fertility. And this is one of my favourite topics, as you know, Claire. We can talk about this forever, can't we? So it's been really lovely. Thank you very much to Dr. Tsakos, to Clare Spink, and also to Janine and Joanne as well, who kindly gave their time to share their experiences. Thank you very much, everybody, and good night, everyone.
Thank you, Sarah. Thank you for hosting this. Thank you. Thank you, everybody, for listening.
Take care, everybody. Bye-bye.
Bye-bye. Thank you, Claire.